Hi everyone. Just gonna go over record keeping and informed consent with you guys. Once again, my name is Dr. Joseph. I am one of the pediatric dental resident here in New York. Um, we are seeing some hope with the coronavirus. Hopefully, it's gonna continue to taper down, reaching the apex, as they say, and hopefully with, social distancing and every precautions that we can take and start tapering down so that the hospitals are not overwhelmed and we can treat those that are in need. Once again, wish I was giving this to you guys live down in Kingston. Life happened and we have to adjust. So for this one, I'm going to go over record keeping and informed consent. So those are two very important topics because, you want to, protect yourself, protect the patient, and know how to treat them, and have permission, consent, and informed consent from the parents. What is a dental record? It's not just this odontogram that you guys are fixated to. It's more than that. It goes outside of teeth. I know dentists just look at teeth, but it's more than that. Dental record is a detailed documentation of the history of illness, physical examination, diagnosis, treatment, and management of the patient. So it's the whole patient in front of you and even things evolving around them. So, with pediatric patient, your dental record will not only include the child, it will also include the parent and those around it. And you also want to protect the health information very well, especially with pediatric patients. You're responsible for whatever you did until the child is 25. You see a patient once when they were 6 months old, you got to keep that record for 25 years or more. Reasons of record keeping, again, it's the best care for patient, means of communication. Sometimes, you have a lot of patients in your office and the only way to keep track of what you've done or what you're gonna do next is by looking at the previous note. And if your notes were sloppy and you didn't write it in great details, you won't know what to do next. And it also defends, you can use it as a defense against allegations of malpractice, as long as you did the right thing and you did it according to the recommendations. And then forensic odontologies as well, as you can see here. So best patient care, means of communication, it can defend you, malpractice and forensic odontology. So this is an important slide. So you have to know the essentials of record keeping. So the essentials of record keeping, it's the official documentation that records treatment provided and all patient-related communication. So patient-related communication includes, let's say after hours, patient contacted you or you contacted a patient or the front desk, any type of communication you make with the patient, you have to document, including phone conversation, quick consults, you have to document them. It is a legal documentation. It's a legal document, so allegation of malpractice, identifying of a dead person, missing person. Dentist is the owner and legal guardian of the record, so you have to take care of that. Patient's legal guardian have the right to view or request copies. So if they want to request them, they have the right to request it. And retention, children, until the age of actually 28, I am sorry. You have to keep it until 28 for adults. You have to keep it for at least 10 years after the last entry. And then you want to protect the health information because it's a civil and criminal penalty for violating can be quite stiff, like heavy fines. Electronic dental records now, people are going from paper, old school paper, to electronic. There are some uh, dentists that have been practicing for a while now. They kind of don't want to change because of some of the disadvantage, the initial expense and learning curve of going from paper to a computer. Um, poor typist, it's faster to just scribble something on a piece of paper. Technology and sometimes HIPAA, but the advantage of them, over time it becomes cost efficient. You're saving space required to maintain paper charts. Because if you do paper charts, you have to maintain a specific space in your office. Now you just have to do an online space to maintain them, improve data tracking and coordination of care so you can easily transfer file between offices. And if you want a consultation, you can just send it online and then improve legibility of records, before it's hard to just read what was scribbled there. And then initial patient record, as you guys know, you have to get to know the patient first. It goes beyond the name. With kids, sometimes nicknames, how they like to be called, so you can connect with them. That goes with behavior management. That means that you know the kid well, and contact informations as well. And then the name of the referring party, why they came, chief complaint, and then a thorough medical history. And then also consider a medical consultation when it's indicated. Again, a thorough medical history. Um, you say, oh, I have a bite, you're just a dentist, you don't know. You need a thorough medical history, especially with kids. If you're going to be sedating kids, if you have the proper training and licensed for sedation, never sedate a kid or treat, for that matter, a child that you don't know, because adverse event always happens on kids that, they had this condition that wasn't identified prior to giving that sedative, midazoline or whatever. So always know the medical history so that you know how to treat the patient. Remember to note in the patient's chart any drug allergy, medical alert, or condition pertaining to the patient's care. That will save you. And then you go to the dental history. You guys are aware with kids, prevention is the key. You want to look at previous dental experiences and fluoride use and exposure so you can prescribe. And then orofacial trauma, family history of caries, because, with little ones, we know vertical transmission and horizontal transmission, and supplemental history for infant and toddlers. So this is specifically for the pediatric, the very tiny ones. So it's very important, know this one. So the history of prematurity and perinatal complications, if there's any, you want to note that. Developmental considerations, social interaction, language, gross fine motor skills, dietary practices, timing of first tooth appearance, oral hygiene habit, toothbrush, toothpaste, and childcare arrangement. So this is specific for our tiny ones, because that again will influence how you're going to practice. For instance, someone with a premature birth, there are certain things that you may have to modify and get medical clearance, prior to proceeding with, such as sedation, because the liver are developing they're a little behind, the kidneys are a little behind in developing, so you don't want to just go ahead and sedate a 3-year-old, 4-year-old. You may cause severe harm. And again, oral hygiene practices, prevention. And again, supplemental history for adolescents, you can read that. But for them, you want to as they getting older in the teenage years, peer pressure becomes very strong. So looking at, the mental health of those teenagers, you can save a lot of those kids from harm by asking the simple questions. How do you feel at home? How do you feel at school? Do you feel safe around your parents? Do you feel safe around your teachers? Those simple questions like that, you can prevent, a child from being abused. And medical updates, as you know, as patients, how are you doing? And then some people would just ask the patient, how are you doing? And then no, reviewed medical history. No, you have to actually review it. And again, some people, unfortunately, never been to the doctor, so you don't know, and all those things. It's funny, but it has a lot of implications to it. So consultation request. So whenever you need one, you have to request it, and this is how you write one. So notice slide, it's red. Name and contact information of the requesting provider. So you're gonna write who's requesting, yourself. Identification of consultants. Type of provider being consulted. So, dear cardiologist, you have a patient that comes in and they have a history of heart murmur. With heart murmur, it's most likely going to be innocent heart murmur, but you want to do due diligence and get your medical clearance. So, cardiologist, you put your patient's name, phone number, address, so that they can contact them, specific reason being asked, and the nature of the clinical service. You're asking them to review a system, and you say they came in for routine dental care. The patient needs this, significant medical history of heart murmur. Mother's reporting that. And you just want them to review and state any recommendations. If they need antibiotic prophylaxis, anything like that. So recommendation for the requesting provider, patient history and relevant findings for consultant special consideration, urgency, patient management issues. So know how to write a consultation, because you will be. When you're treating patients, you're not just treating them in your bubble. You are treating them in a network of providers. Comprehensive clinical exams. As you guys know, you go through your extraoral, intraoral exams. Treatment planning, you want to have diagnostic stuff. So for us in dentistry, sometimes getting those x-rays, it's a pain in the rear end, and you have to retake it and retake it and retake it. But again, you have to weigh the risk versus the benefit, especially in the pediatric population. You don't want to just keep re-exposing them. At the same time, you want to have diagnostic x-rays. So that's why with kids, if they are pre-cooperative, they won't cooperate for diagnostic x-rays, then it is, and you look in the mouth, you know that they will need, a lot of treatment, then it is an indication for general anesthesia. So you can take diagnostic x-ray and treatment plan and do comprehensive full mouth dental rehab under general anesthesia. So if the patient comes for limited care only, like emergency, you still must obtain a medical condition, unless that dental treatment you're about to do, if you don't do that treatment, the patient will die. But you still have to. Progress note. In your progress note, you must want to be accurate and objective. Objective. You want to omit any bias, any implicit bias towards a certain group. So you want to be objective in your finding. We're going to go over the difference between subjective, objective assessment and plan. Again, medical history documentation, review of system. You want to review your system. And then you finally get to the dental history. You're like, finally. And the patient also will say, finally, sheesh, this dentist thinks he's a physician, but not, you get to the medical history, dental history. You just review the dental history. I'm going to highlight some of the ones that are important for kids. History of smoking, usually the parents. You want to go over how that's detrimental for the kids. Habits, because you want to suppress any habits that are continuing. Snoring, implication with sedation, and oral hygiene, fluoride exposure, future orthodontic needs. So the parents can prepare for that. You do your clinical exam. You, TMJ, not really occlusion. For kids, it's really good. As a pediatric dentist, you are guiding the patient's occlusion as they're growing. That's why I love this profession. I love treating kids because it's moving parts. The teeth are moving, it's growing, the jaw is moving, and you can modify and help them with that. So when we do that, you have to know the occlusion. Profile, molar, canine relationship, overbite, overjet, and just make sure that the occlusions are, the final occlusion is ideal. And then subjective, objective assessment and plan. This is important. This is an important slide. No soap. So subjective, patient's response and feeling to treatment. Chief complaint. So subjective, you have a patient that comes in and the patient tells you that, you have a mom comes into your office and the mom goes, my child has pain in the bottom right. It's been bothering him for the past 2, 3 days. Can't eat, can't sleep, all of that. It's waking him up in the middle of the night. That's subjective. That's the chief complaint. And then objective is what you are gonna find. Objective findings. So you look in the mouth, you do all your tests, you take your x-rays, your clinical observation or measures, you take diagnostic x-ray, you do clinical exam, you do all your tests, and you say, oh, there it is, found the problem. Tooth number S and T has deep caries lesion, advanced caries lesion into the pulp, and your child has irreversible pulpitis with mild gingival swelling. That's your objective finding. So you write that. Sorry, your objective finding would be what you are seeing, your clinical observation on measures. Sorry for that confusion. Objective finding would be your clinical observation and measures, which would just be like advanced dental caries and gingival swelling. But then your assessment would be a differential diagnosis. So that would be irreversible pulpitis or necrotic pulp abscess, So usually people confuses the two. So objective finding, it's your clinical observation, what you're observing. Just state what you're seeing. Gross decay, advanced caries lesion, mild gingival swelling. You look at the x-ray. It carries into the pulp. There's a periapical lesion. Those are what you're seeing. But then your assessment, you're like, okay, I think so. It carries into the pulp, waking up at night. So this is consistent with irreversible pulpitis. Or if the tooth was asymptomatic, positive percussion, you do your endo test, you're like, okay, this is consistent with necrotic pulp. So that would be assessment, your differential diagnosis, the likely etiology. But then your plan, it's easy. That one is easy. What are you going to do? Extraction, pulpotomy, and then you want to also, but then you do your plan, you tell the parents what your plan is, and then you have to obtain an informed consent. Okay? An informed consent is a process of providing the patient you tell them what you find and relevant information, different options, and no treatment. You educate them about them, and you let the parents make the decision. Patients build of right and responsibility. You want to it makes it clear the responsibility of the dental team to providing information and appropriate treatment while granting autonomy to the patient and or legal guardian over medical decisions. Okay, medical necessity documentation, informed consent again, and then always remember to ask yourself, what does the patient or the patient's primary caregiver needs to know and understand? Is the patient and or caregiver capable of understanding what I'm saying? Does the patient and or have capacity to give consent? Can they give consent? If not, who is qualified to decide? Is consent given voluntarily? Ask you those questions. Who gives consent? Minor. It's going to be parent or legal guardian. Individual with developmental disability. As a pediatric dentist, you're going to see them a lot. You assess their mental ability to give consent. Can they give consent? If not, determine who's the legal guardian. Age of maturity, it's 18. So when it's 18 and over, that kid can give consent by themselves. But then you have emancipated minors, minor that is legally considered an adult and therefore capable of giving consent. Good Samaritan laws applies as well. Okay, and then those are just some scenario that you go through, and failure to obtain an informed consent will result in a criminal charge. Just know that. There are limited privileges in certain emergency situations, but at all means, get your consent. Okay, get your consent. It's very, very important. Informed consent is not only a legal regulation, but also a moral principle, which represents patients' right to take part in the clinical decision concerning the treatment. With a pediatric patient, it's most likely you're going to be talking to the parents and legal guardian, and as the child gets a little older, they understand, try to get them involved. Like, a 13-year-old will understand what's going on. Have them involved. Okay, 4 basic principles of dental medical ethics, know that as well. Autonomy, beneficent, non-maleficent, and justice. Autonomy, you respect the decision of the patient and legal guardian. So you want to be truthful, respectful, and protect their privacy. Beneficent, actions should benefit the patient. So balancing benefit and risk and harms. So you want to prevent and remove harm, rescue person in danger. Non-maleficent, just don't do no harm. And then justice. Thank you. I want to go back here because this is very, very important to understand. I think I might have confused some people. Let me review this again. So I'm going to give a simple example. You have a parent that comes into your office, and the chief complaint, aka the subjective finding, is my child has pain on the lower right, and I see a little pimple. The pain wakes my child up at night as well. Okay, that is your subjective finding. Objective finding, the patient is sitting on the chair, you take an x-ray, you look in the mouth, you do your test, and you write what you find. So you look in the mouth, tooth number S and T, it appears to be involved. So number S, you see a large caries, so you write large caries, gross decay, and then that pimple on the subjective, objective, you write gingival abscess, gingival swelling, and T has occlusal decay, restorable. S, you think it's non-restorable. But then assessment, what are your differential diagnoses? So the likely etiology. So you're like, okay, S, it's necrotic because, look at the X-ray on your objective, you find that they were periapical lesion on S, the radicular lesion that may, go into bone and the succedaneum tooth. So your assessment would be S is necrotic, and then T, it's irreversible papillis. So you're giving the name on your objective findings. And then your plan, that's easy. What you're gonna do to resolve the problem. S, extraction, T, pulp SSE. And you give parents, you review that, you give them alternatives, and you educate them, you give them the post-op, what to expect, such as bleeding, biting on gauze, so that they can make an informed decision on whether or not to proceed with what you are presenting to them. That's it, folks. Stay safe, and hopefully I will see some of you guys next year when we come to the 2021 pediatric dental course in Jamaica, and life hopefully doesn't throw us another challenge next year. Stay safe and God bless. Thank you. Bye bye.